Many people believe that teletherapy came about as a result of the pandemic and resulting school and office closures all around the world. While this was a time where virtual learning and teletherapy became household terms, the fact is that teletherapy has been a tool that schools across the country have used for over a decade. And e-therapy has been providing virtual support and teletherapy services since 2009. So, what exactly is teletherapy? Teletherapy is defined as any remote therapy that uses technology to help the therapist and client communicate. In many instances, it's been found to be more convenient for both the client and the therapist. In fact, most research even suggests that teletherapy works just as well, if not better, than in person counseling. Benefits of teletherapy compared to traditional on site counseling include greater access to care, as obstacles such as transportation, physical disabilities, and scheduling or geographical locations don't have impacts. The elimination of transportation costs and childcare costs to attend appointments. Increased privacy since the client can be in their own home. And finally, high patient satisfaction since telehealth can be delivered conveniently and easily through any available device that can connect to the internet. Now that we know the benefits of teletherapy, it's important to know what parents can do to make the most out of their child's teletherapy experience. Some things to consider to ensure you and your child get the most out of their teletherapy supports include identify a place where distractions are minimized, such as a room or space away from others. Utilize earphones to eliminate background noise and increase privacy and confidentiality. Make sure your chosen device is charged or plugged in and connected to the internet before the session begins. Keep a notebook and a pen or pencil handy for taking notes, completing activities, or communicating with your therapist. And finally, plan on sessions lasting 20 to 30 minutes for younger elementary students and anywhere from 30 to 50 minutes for older middle and high school students. Just like in-person therapy supports, parental involvement and communication is important when receiving teletherapy services. While things discussed between your child and their therapist are confidential, parents are always encouraged to communicate questions and concerns to help both their student and the therapist who is working with them. In addition, there are things that the parents can do to support their child at home and reinforce new tools and skills that are being discussed during the teletherapy sessions. Finally, since family dynamics impact all of us, there may be times that the parents can discuss changes that they can make or receive recommendations from the therapist regarding additional support that may benefit the entire family. As parents and guardians, you know your child best, and you are such an important part of the teletherapy process. eTherapy has partnered with your school to provide school-based mental health supports for this school year. Counseling services are provided by licensed professional counselors trained to work with youth of all ages. We encourage all parents or guardians to make use of these supports and become involved in the process of developing healthier students and healthier classrooms. We thank you for partnering with us over the course of this next school year, and we are excited to work together to support all of our students and the entire school community.